Senior Moments, sponsored by the Empowering Seniors Group on News Talk KVNU, 102 FM and 610 AM.
Good morning and welcome to the Senior Moment Show. We are back again for another fun show. My name is Bruce Lee. I'm here with my co-host Sid Roeder. Good morning, Sid.
Good morning, Bruce.
It's good to see you today.
Good to see you too.
It's nice to be summer, sort of, warmer.
It's nice to be summer, yes.
Yeah. Well, we've got a great show today for anybody who may have slipped on the ice during the winter, actually. So we'll get to that in just a second. That's our teaser, right? But before we get to that, Sid, why don't you tell us about our sponsor?
Absolutely. Our sponsor is the Empowering Seniors Group, which is a group of professionals that has dedicated their time and efforts to provide information to seniors, their family members, and really anybody who cares. If you'd like to learn more about the Empowering Seniors Group, you can do so online at empoweringseniors.info, or you can email us at empoweringseniorscv@gmail.com, and the CV stands for Cache Valley. And lastly, as always, if you have any suggestions for this show, anyone you would like to see us invite, you can call me personally at 435-512-6406.
Thank you, Sid, and thank you for taking those phone calls.
Absolutely. It's my pleasure.
It's fun. Okay. We welcome to the show today Brent Rawlings and Amy Nuppy, and they are physical therapists with a great company here locally called Back at Work. Welcome to the show.
Thank you very much.
Thanks for having us. It's a pleasure to be here.
We're so glad that you're here. Before we get into kind of your day-to-day and what's going on at your company, let's learn a little bit about you. We'll start with Brent. Brent, you're a physical therapist.
Yes, I am.
Tell us a little bit about why you chose that path and what's important to you about it.
Okay, like most people who are physical therapists, we've had physical therapy in the past, and I had that during college, and I changed my major to align with physical therapy. I went to physical therapy school in Iowa and then came back to Utah to practice here.
Okay. And how about you, Amy? Tell us a little bit about yourself.
Sure. So I graduated from PT school in 2010. I had, similar to Brent, I had some minor injuries in high school and college, went to physical therapy probably 4 times before I went to PT school myself, and had practiced physical therapy for a couple of years, started in 2010, and moved to Columbus, Ohio, where I was really fortunate enough to join a team that practiced vestibular rehabilitation, which I'll talk to you a little bit about today, and just a really talented team of people that they're a lot smarter than I am, and I learned so much. And so when I moved to Cache Valley 3 years ago now, I've had just the joy and privilege of helping people that feel dizzy and off balance.
I know we're going to talk about this more, but you're just going to have to tell me what vestibular means, because I should know and don't.
No, it's a big word. It's vestibular. V is in Victor, and so the vestibular system is essentially your inner ear and part of your brain called your cerebellum.
Oh, good. So if I'm having a problem there, I know I have a brain.
Exactly. Well said.
That's good, because that may happen.
So,
all right. Go ahead, Sid.
Sorry. So then if you're dealing with the inner ear, then you're also dealing with vertigo patients, I assume?
Exactly. Yes. And so vertigo is it's a symptom rather than a diagnosis. And same with dizziness. There's lots and lots of reasons people can feel dizzy or experience vertigo.
And that's why they might come to you. Do you diagnose that, or they go to their doctor and get a diagnosis and come to you for help?
Both. Sometimes they'll go to their doctor because they feel dizzy, they feel off balance, they may or may not have had a fall, and they'll either talk to their doctor, or sometimes if they've heard, hey, Back at Work does vestibular rehab, they may just call us directly and see if they can see us.
Okay, so we've before the show we talked a little bit about some of the things you do that might be particularly interesting to some of our senior citizens and others. Let's talk a little bit about falling.
We know in the USA, 1 in 4 adults will fall this year. That's 36 million falls in the U.S. These falls result in 32,000 deaths. 1 in 5 falls will result in a serious injury, such as a broken bone or a head injury. 95% of hip fractures are caused by falling, and it's usually from falling sideways. 80% of the people who present to the ER with a fall-related injury have vestibular issues. So, and if you've fallen twice in 1 year, you need to get checked for your vestibular system.
So when you say they show up at the ER and they have had a fall, and then they are then diagnosed with a vestibular issue as a causal thing, is it common that they don't know they're having that issue? Or are they know that something's going on, but then they finally have the symptom of the fall?
That's a great question, Bruce. Thank you. It's it could be either. So someone might slip on the ice, let's say, and unfortunately break a wrist or a hip, and so there's a good cause for that fall, and so they may not have a vestibular problem, but if someone's falling a little bit more frequently or spontaneously, they may have some pre-existing undiagnosed problem with their balance and their vestibular system that actually causes them to fall. And so while Brent and I are concerned and will help with some of those orthopedic issues that you might have after your fall, we do want to take a step back and really talk about why you're falling in the first place. And so, another thing too is if you fall, you may hit your head and perhaps suffer a concussion as well. And so often people with concussion will have dizziness and imbalance and headaches and that sort of thing. So we just want to unpack that.
Yeah, just a follow-up on that. You didn't mention this, but I bet you have some statistics on this, Brand, about age-related falling, because I know there's some statistics there that have to do with, as you age, the frequency of falls, risk of fall becomes higher. It seems like also my experience working with people that are older, they're starting to deal with some balance issues. If someone's in their home, what's normal? When should I think, gosh, maybe I'm having something I need to get checked? Because I might go around and maybe I'm experiencing some core body strength issues or something like that, or maybe I have a vestibular issue that you've described. When should I think I should go talk to somebody?
There are lots of risk factors for falls, lots and lots of them, and sometimes and unfortunately, as we age, our balance doesn't naturally improve, unfortunately. So it can be just muscle weakness, history of falling, fear of falling can actually predict falls. But if you're walking around your house in the dark and you notice your imbalance is a little bit worse, imbalance with walking on uneven surfaces, you're having some trouble. If you're feeling dizzy, if you're falling one direction or the other or backwards, you might really want to touch base with your doctor.
Thank you, Amy. We're coming up on our first break here in a hurry. So for our listeners that are interested and maybe have questions after the show, when we come back, we're going to ask Brent and Amy for their contact information so you can contact them to set an appointment or to ask some questions. This is the Senior Moments Show. We are sponsored by the Empowering Seniors Group. If you'd like to learn more about the Empowering Seniors, you can do so online at empoweringseniors.info, or you can email us at empoweringseniorscv@gmail.com, and the CV stands for Cache Valley. Again, this is the Senior Moments Show. Stay tuned. We'll be right back.
Did you know 1 in 3 people will visit a nursing home? Did you know that once there, they will stay there for an average of 3 years? Did you also know there are insurance options that can help cover this experience? Hi, I'm Tracy Ferris with Blue Water Health Insurance. It's not cheap to stay in a full-fledged nursing home. Long-term care insurance can help you or a loved one get the care they need and deserve. If you wait until you need it, you may be too late. Give me a call at 435-890-8155. 855.
This is Mark Thurston with White Pine Funeral Services. The best time to plan is when you have time to plan. Having a prearranged funeral gives peace of mind for everyone involved. White Pine will customize your final wishes to fit your needs, from a traditional burial to cremation to a custom headstone. White Pine also accepts prearranged plans from other mortuaries, and we will absorb any transfer or revocation fees. No penalty to you. Visit whitepinefunerals.com or come and see us for more information.
White Pine Funeral Services, here when you need us most.
You have a lot of options when it comes to buying or selling a home. Do you list it online, sell it yourself, or do you have a realtor help? It's a major financial and emotional decision. A realtor is the liaison between buyers and sellers and really helps you navigate complex contracts, deadlines, and disclosures.
Hi, this is Sid Roeder with Achievement Realty.
I work for you to get the best outcome for your situation. Let me earn your trust with a free consultation and a free market analysis. Call me today at 512-6406. Then list it, sell it, and move on.
It's tough knowing how to care for an aging parent. Mom has always been there for me, but now I need to be there for her. When we found out she needed surgery, I wondered how I could attend to her needs and still be mom to my kids. I was so relieved to learn about transitional rehab at Maple Springs in North Logan. From the nurses to the physical therapists, it was like their whole staff was focused on helping Mom get better. Maple Springs in North Logan was an answer to my prayers.
Learn more at maplespringsnorthlogan.com or call 753-9400.
Welcome back to the Senior Moment Show. If you're just joining us today, we're visiting with Brent Rawlings and Amy Nuppy. They are both physical therapists at Back at Work, which is a local company. However, they don't work in the same office because there are two, right, Brent? And that's so quickly, Sid mentioned as we're going out that you're going to give us some contact information. So tell us a little bit about that. And then you're kind of chomping at the bit to expand on what Amy was saying. I'll let you go ahead and talk about that too.
Sure. So I'm the director of the Logan North Clinic, which is on 1400 North. We're in that Sterling Urgent Care building. And Amy?
Oh, and I'm the clinic director at the Logan South location.
All right. So as far as further risk factors, like we talked about, some of us just notice that gradually over time we're not as strong as we used to be. We have more difficulty getting out of a chair or up and down stairs. We may have a slower pace. We may ask somebody to kind of help us up and down curbs or getting out of a car. Those are all indications that you probably need to look closer at getting stronger and better flexibility. Sometimes it's the way our house is set up that creates the problem, and so we want to make sure that we're doing things at home as well to use grab bars, move the clutter off of the floor, those light cords, avoid the slippery surfaces, make sure you've got good light when you get up to go to the bathroom at night. Make sure you're not wearing clothing that's too long that you might trip on. All of those things. Make sure you're having appropriate footwear. Sometimes eyeglasses themselves can be the problem. If your prescription is making things look too far away or too close, it may alter your perception of where you are. So sometimes those are some basic things. I'm a board-certified orthopedic specialist as well, and so I treat all of those other factors outside of the vestibular system that people need to look at. Say you're getting weaker over time, you're not as flexible as you used to be, your reaction time is slower than it was. These are all things that can be addressed with physical therapy.
So I want to circle back a little bit on the diagnosis, because you've said before you can diagnose or it can come from a doctor, but if somebody were to come to you and say, okay, I'm feeling dizzy, what's a typical path? Do you send them back? Do you do some diagnosis and then send them back to other specialists, or how does that work?
That's a great question. As I said earlier, there's lots of reasons why people can feel dizzy and off balance and have vertigo, which is that spinning sensation. And so, certainly talk to your primary care provider about, is it my medication, or is there a heart issue going on? That's who you would want to certainly talk with. If you have a sudden hearing change, all of a sudden you lose hearing in one ear or both ears really suddenly, rather than slowly over time, then please go see ENT and get your hearing checked and get treatment there. If you're additionally, in addition to your dizziness, having numbness or weakness on one side of your body, if you're having slurred speech or trouble swallowing, double vision, tunnel vision, those are more emergent signs. And so you do want to seek urgent medical care at that time. Those would be signs of potential stroke. And so that's what you want to, we want to get that urgently looked at, obviously. So
if I am thinking, I'm listening and I'm thinking maybe this might be a benefit for me, and I feel pretty good, I'm pretty healthy, I think, overall, and I don't think really have much going on, but I'm curious about whether or not this might help me, especially maybe for some preventative stuff, because I'd rather not have a problem.
Right.
And so it sounds like there's maybe some opportunity for preventative. Do you guys offer like a consulting thing to where I can come down and sit with you and you can say, you probably ought to go visit with your doctor about that one, or you know what, just come on in, I think we can help? Brent?
Absolutely. We love it when people come in and say, I've got a concern. I'm not sure if this is a big deal or not. We can go ahead and do a thorough assessment of them. And if we need to refer them on, we will definitely do that.
Okay. What about, is that free, that consultation, or is there a charge for that? Or is there some point where there is a charge? How does that look? So my initial visit, can I just sit and ask you some questions?
Occasionally we will do a consultation, but if it requires like a more in-depth evaluation, like I'm having dizziness and I need to find out why, that's just not a simple conversation. That's something that requires some testing. And in that case, if it's more in-depth, we would do a very thorough evaluation, just simply so that we can rule out anything that we need to get checked out first with a physician first, maybe do some testing to rule things out first. The other thing is that most of our listening audience may be a Medicare, and so in order for us to see them, they would need to have a prescription signed by their doctor before we see them.
Okay. I'm just curious, out of all, is there like a statistic on what is the most likely thing if you have dizziness? Can you talk about that a little bit?
Absolutely. So I would love to just share a little bit about what vestibular rehabilitation is and what we can do to help. And so in the older population, of those who feel dizzy, about 40% have something called benign paroxysmal positional vertigo.
Oh, I'm going to ask you about that.
You bet. So benign means it's not something you will die of, though people that have it will say it is not benign. It does affect your life. It does make people fall. Paroxysmal is kind of a ramping up and going away. Positional is brought on by position changes. So I'll ask my patients, do you feel dizzy for typically a minute or less when you roll over in bed, when you get up in the morning, when you lay down at night, when you bend over? And then vertigo is that room spinning sensation. And so we have 3 canals in each inner ear. And most commonly, it's in one particular canal on either side. And so we can use gravity and repositioning maneuvers. Many people are familiar with the Epley maneuver. It was just founded in 1980, actually, which isn't that long ago. But it's very effective treatment for that particular diagnoses. And so we have, people call them stones or crystals or rocks. They're otoconia, they're earpieces in our inner ear, and we're supposed to have them, but when we move our head, they tell us where upright is, essentially, and how we're moving. But sometimes they get in those canals where they shouldn't be, and that's when we feel dizzy or imbalanced. And actually, as we age, that sensation of vertigo can actually decrease over time, and so people might feel suddenly imbalanced, say, do you feel dizzy, and maybe a little bit, but then we go and we check, and they do in fact have BPPV is what we call it, and most commonly in 1 to 2 visits, people can be all better most of the time.
Thank you, Amy. We're already coming up on our second break here in a hurry. Amy, previously we had asked about your location. You just said you were South Logan, so maybe you can give us your address, your physical address, and also the phone number where somebody could reach you.
You bet. We're on, our address is 939 South State Highway 89. So if you're heading south out of town, we're between the Wendy's and McDonald's on the west side of the street. And our phone number is 435-216-4343.
And Brent, we didn't have your phone number there in the north end.
435-213-3850, and we're at 630 East, 1400 North in Logan.
Thank you. This is the Senior Moments Show. Stay tuned. We'll be right back.
Hi, this is Bruce with Comfort Care. One of the ways we help loved ones stay in their home is by assisting with daily tasks. These may include bathing, meal preparation, medication reminders, and housekeeping. We even help with shopping, transportation, and errands. Most of all, we offer a trusted level of care. Let us help you live your best life possible with Comfort Care. This is Bruce, and you can call me at 754-7676. Comfort Care, 754-7676.
Reed's Pharmacy in Hiram offers free delivery service 5 days a week, Monday through Friday throughout the valley. Just stay home and they will deliver to you. With 25 different suppliers, they won't have the shortage that others might have. Also, with compounding and many other services, they will be able to serve all your needs. In order to stay safe and help slow the spread, please call Reed's Pharmacy in Hiram at 245-DRUG, and they will take care of you.
This is Brian Erickson for the Sunshine Minute. Each day, our nurses, CNAs, cooks and servers, housekeepers, laundry staff, music, recreation therapy teams, office staff, receptionists, and many more arrive around the clock. These heroes show up ready and willing to serve and protect our residents and clients. We are so grateful to our dedicated team. On behalf of the Board of Sunshine Terrace Foundation and our community, thank you to all of our employees for keeping us safe. We bring more to life together.
Welcome back to the Senior Moment Show. If you're just joining us, we are visiting with Brent Rawlings, physical therapist, and Amy Nuppy, physical therapist with Back at Work, of which there is one on the north side of Logan and on the south side of Logan. I did learn something important today that my mom would be happy. Did you say there are rocks in your head? Because my mom always said,
yes,
what's your problem? Are there rocks in your head? And I'm pretty sure I can say yes. And it was normal the whole time.
Correct.
Okay. Just wanted to make sure.
We all have them.
We have rocks in
Mom was right.
Mom was right. She was never happy when she was asking me that, though. It was always, what's wrong with you? But anyway, okay. Let's talk about Back at Work, and maybe we've talked about some of the things that cause or somebody to need to go to Back at Work and get some help. What's there once they get there? Brent?
Okay, we have a wide range of equipment and things that we can use as interventions to help after we've done a very specific and thorough evaluation of people. We see a wide range of orthopedic conditions, which would be anything that causes musculoskeletal pain, hip pain, back pain, knee pain. All of those things can also affect your risk of falls. If you are in pain, it's going to make you move differently. You're going to maybe walk differently. You'll get out of bed differently, and you'll be able to put your clothing on differently. We have an anti-gravity treadmill at our clinic in the north location. We can take up to 80% of the body weight away, and they're fully supported. So if someone is having difficulty with walking, even across the parking lot, we can put them in there, take some of their body weight away, and support them, and they can walk for 10 or 15 minutes with no discomfort. So a lot of people have benefited by retraining their ankle, their knees, and their hips, and getting more stamina on using this anti-gravity treadmill.
So, quick question on that, because it sounds like there's a lot of exercise. Do you usually send people home with like an exercise regimen to heal, or do they have to come in for that training?
It's a great question. It's typically both. So people come into physical therapy in person for progression of skilled exercise, and especially if we're doing specific balance exercises, we can make sure you're safe doing them, and then we'll give you exercises for home that we know are safe, but that will help you in the long run. And sometimes some hands-on is helpful as well.
When someone comes in, how long are they there? Is it hour, 2 hours, half hour? What's a visit look like?
Our typical visit is an hour. We really like to evaluate each time they come in to see how are you progressing along, and do we need to modify your care in any way. And then we'll implement an intervention that builds on their previous interventions. If they're having trouble with certain things, we'll assess that and modify that so that they continue to make forward progress.
So, Amy, we talked a little bit in the break about statistics, and I was pretty shocked because you shared one about vestibular dysfunction. Do you want to share that with our listeners?
Sure. This is from the CDC back in 2009 that vestibular dysfunction or problems, the prevalence is actually 85% in those aged 80 or older. And so If, let's say, you don't have BPPV, you can still have problems with your vestibular system and imbalance. And so there are other specific vestibular exercises that we can prescribe if we find that that's indicated. And so that will help improve your balance and with head motion as well.
So whenever I hear a stat like that, I'm always like, and I'm in the category, I'm always like, great. I'm in the category that has this problem, and and I want to know what to do about it. And so if 85% of people, you said age 80 and above, correct? I mean, that's a significant number of people.
It is.
Do I just have to accept that? What can I do about it?
Well, our goals for your listeners right now are to keep people safe and independent and having good quality of life as long as is possible. And so, that's why we do those, help people with those exercises and, maybe fit them with a cane or a walker just to keep them safe and independent and really enjoying life. And so that's really our goal for your listeners.
So is that then maybe a recommendation for someone to come in and get a little assessment to kind of get an idea, to get some planning?
Absolutely. Sometimes people know they need to do something, but they're not sure exactly what to do. And so it's nice to have somebody who is trained and has certifications in these things to be able to assess specifically what are the impairments that we're working on, what are the functional limitations that people are having, and what do we need to do to go forward.
Well, we're running out of time, but a quick question. What if it's not me? It's my parent or somebody else that I know. What options do I have to help them to get access to these types of services?
So if it's your parent or your loved one, you're going to have to try to convince them to come to the doctor.
They need to be there.
Sometimes people come in our waiting room and they look and they're like, I'm only here because my husband or my wife told me to be here. But getting there is the first step to improvement and assessment. So we'll leave that part up to your listeners of how they're going to get them into the doctor's office or to the physical therapy clinic. But just know that there is help available for people who have these issues.
Okay, Brent, then we're at the end of our show. Let's make sure that they know who to call. Can you get both your numbers out there?
Sure. So for Brent Rawlings, I'm the director of the Logan North Clinic, which is at 630 East, 1400 North in Logan. And our phone number is 435-213-3850.
And Amy Nuppy, Logan South, phone number is 435-216-4343.
Thank you, Amy and Brent, for coming in. It was great to have you. And for our listeners, I hope this was interesting, and you tune in again next week.